Welcome, everybody. We're so excited to have you join us today for the April Health Innovation Community Partnership meeting. Welcome, everyone, to the Los Angeles General Medical Center. We're going to go ahead and get started. As we know, we have both guests joining us today in person in the Inpatient Tower Conference Center at the Medical Center. We also have a lot of people joining us via Zoom, so this is indeed a hybrid meeting. We want to ensure that everyone has the best possible experience and really gets to participate fully in our meeting. So we'll be taking questions both within the room and within the Zoom feed. So please join us and participate fully. With that, we'll go ahead and kick things off. Just as a reminder, this meeting is being recorded, and the recording will be available in about a week's time alongside all the meeting materials on our website, which is hicpla.org. Again, we want this to be an interactive session, so we encourage everyone to raise their hand in this room or raise their hand or type a question into the chat in the Zoom feature. We also want to note that our meeting has Spanish language interpretation, both within Zoom and here in the meeting room. So we ask all of our speakers, myself included, to pace your speech so our interpreters can keep up. And please try to avoid technical language that may not translate very well. Let's go quickly through our agenda for the day. We'll kick things off with our registration and welcome. We also will then turn to the Los Angeles General Medical Center for our regular updates. Joining us today is Chief Medical Officer Dr. Brad Spellberg with some of those updates. Then we're going to pivot into our community health update today, also by Dr. Spellberg. Then we'll be having a presentation from LA Metro on the Los Angeles General Medical Center MetroLink station. We'll also have a presentation from our partners at East Los Angeles Women's Center about April as Sexual Assault Awareness Month and how we can participate and support their initiatives this month. We'll take a quick networking break and we'll come back with a series of 3 presentations for the second part of our program, all about campus projects. So you'll get to hear about some updates from Restorative Care Village Phase 3, the Century Project, also Restorative Care Villages 4 and 5, as well as the Centennial Project. So it'll be a really exciting and very jam-packed agenda today. With that, I'll go ahead and read aloud the guiding principles that guide all of our work together here at the HICP meeting. So all participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive common set of information with which to solve problems and make decisions. Participants will jointly design next steps. Now, before we begin our meeting today, we wanted to share a moment of silence in remembrance and recognition of Dr. Father Estrada, who just passed away earlier this week. Dr. Estrada was the founder of Jovenes Inc. and a guiding light in this community who had devoted so much of himself to the residents of Los Angeles County. So I'm not sure, Rosa, if you would like to add a few words about Dr. Estrada. Barring that, we will perhaps revisit it at the end of this meeting, but I just wanted to ask everyone to join me in a moment of silence in remembrance and reflection on the great legacy and life of Father Richard Estrada. Thank you. And with that, we'll begin our presentation today. I invite Dr. Spellberg to the podium.
Okay. All right. Very good. Good morning, everybody. I know that there have been questions that have been asked, and we were asked to talk a little bit about the financial situation, the fiscal status in the county. And so we've just prepared an overview for folks, and happy to answer any further clarifying questions to the extent that we're able. So just as general background, LA County Department of Health Services, LA General, is the largest of the 4 hospitals in the LA County Department of Health Services, and there are also around 20 clinics. We serve principally patients who are funded by Medi-Cal, which is California's version of the federal Medicaid program, and uninsured patients. That's about 80 to 85% of our patient population, Medi-Cal and uninsured. Amongst the Medi-Cal population, there are 3 principal Medi-Cal providers for patients that we see. There's LA Care, Health Net, and Molina. Every now and then we'll see another Medi-Cal contractor as well for patients, but it's most of our patients with Medi-Cal have one of those 3 health plans. So there's a lot of questions going on about what's going to happen to Medi-Cal funding. And I think that's exactly the right way to phrase it. There's questions. We don't know. This is the bottom line, right? The House has passed the bill. The Senate is passing their version. There's going to have to be a reconciliation. And until there is a reconciliation at the federal level, none of us knows what's going to happen with Medi-Cal. So it's really more uncertainty. People are concerned about certainty of change. We don't yet know what is going to happen. We are sort of making plans to, in case there are changes, and we are using the uncertainty as an opportunity to really take a cold, hard look at everything we do to see, are there areas in which we can improve efficiencies? So we're looking to see if there are ways for us to expand revenue. And we have, for example, an effort underway to improve our documentation, something called Project Monarch, where we'll have electronic tools for our physicians so they can document to maximize the potential revenue that comes in based on existing payer sources. And we're also looking at, are there things we can do to streamline efficiencies so that we can provide the same care at lower cost? Those are things we're sort of proactively doing now in case there are major changes to Medicaid that are coming. As I said, we don't really know what's going to happen with Medicaid. There's a variety of scenarios that may play out. Whatever does happen, we will respond to. And one of the questions is, will patients stop receiving care? People should understand, again, the 2 biggest patient populations we care for are those who have Medicaid and those who have no insurance. If, unfortunately, changes at the federal level result in fewer people having Medicaid and more people being uninsured, we will care for those patients. That's our mission. And so it won't change their ability to access our care, whether they have Medicaid or not. It will create some financial stress because there will be less revenue attached, but we will figure out how to deal with that, again, by improving our efficiency and trying to maximize our revenue. Are there any service cuts planned? We're not planning right now to cut services. We are, as I said, planning to improve efficiencies. So we may be able to deliver the same care more efficiently at lower cost if there are very substantial cuts that end up being made to Medicaid. Well, we might actually end up then in a position of having to curtail some services, but we're not there yet. So we haven't reduced services for that reason. We are preparing, as I said, we're trying to proactively improve our efficiency and increase revenue. But we're going to wait and see, before any substantive changes are made, we're going to wait and see what happens. So before we go on, any questions or points of clarification that I can offer?
If you give an example of what does it mean to improve efficiency?
Sure.
What might that look like?
Sure. So I could give a couple examples. We have I won't, there's a clinic, for example, that actually is open 24/7. And that requires nurses and physicians to be present in the outpatient space, which is unusual for a clinic 24/7. But we already staff an ER 24/7. And so we're asking the question, should we have that clinic close at 8 p.m.? And if patients come in between 8 p.m. and 8 a.m., those patients can come to the ER and be seen. So it's not a reduction in service. They still have access. They'll just be seen in a place we're already staffing 24/7 instead of staffing two places 24/7. We're also asking our doctors to take a cold, hard look at the drugs they prescribe. You know, when a new fancy schmancy drug comes out and it's very expensive, is it actually better than the cheap version that's generic, that's been on the market for a long time? And we're trying to find, let's find those opportunities where we can provide the same care, but at a lower cost, essentially.
Great. Thank you so much. I also wanted to ask, you mentioned about maximizing revenues, and it sounds like that's just more greater documentation at this point. Do you think that there's a pretty big shortfall between what we could be achieving from a revenue point of view and where we are today?
Well, that's a good question, Heather. So we actually are much better than we were. So for Medicare patients, which again is a minority of our patients, less than 10%, the marker of reimbursement and documentation is a term called case mix index. When I started in 2014, our case mix index was around 1.3, and it's now 1.7. So it's already up 30 to 40%. And that means 30 to 40% more revenue for caring for the same patients. But I don't think 1.7 is the best we can do. So if we can get it up to 1.9, there's another 10, 15% of revenue. So I think we've already made major improvements, but I think there probably is opportunity to improve it further.
Great. Thank you. Do we have questions from the audience?
Can you explain like the 1.7, 1.9? That means like, I don't understand the percentage, like in people, maybe? Like, what does that mean? I don't know.
So I'll try to distill it. I know it's complicated. Is when we have a Medicare patient, not a Medicaid or Medi-Cal patient, Medicare patient, Medicare pays a flat rate based upon the number value. So we have a base let's just for math, this is not entirely accurate, but just to make the math easy, let's say we get the base payment is $10,000. If the case mix number is 1.5, you multiply 1.5 times the 10,000, and that's what we get paid, $15,000. So there's a linear relationship. As that case mix index goes up linearly, Medicare payments will go up equivalently. If we can go from a case mix of 1 to 2, we will double our Medicare revenue. Does that help? Okay.
And that I would assume that means that basically the complexity of the case and the needs of the patient are better documented, so you can claim more revenue in return for the Medicare patient.
Right. Yes. Medicare pays a flat rate based upon the diagnoses the doctors indicate in the medical record the patient has. If we document suboptimally, you don't get the right diagnoses, the disease severity appears less than it actually is. So what we're trying to teach our teams to do is to document accurately so we get credit for how sick our patients actually are when Medicare decides how much to pay us.
Before we move on, do we have any other questions from the audience? Any questions from our online audience? Raise a hand, please. Okay, we'll let you continue, Dr. Spellberg.
Very good. Next slide.
Oh, I'm sorry. You had said we'll pause here for questions, so I assumed it was a pause.
I think the next slide is moving to Mag. So, yes.
Got it. Okay. Well, we'll transition in speakers then.
Good morning, everybody. My name is Ria Sangalang, and I am the Magnet Program Director at here at LA General. And I'm here to share with you some wonderful news about the hospital, right? So our organization is applied to be a Magnet designated hospital. And what is Magnet and why is it so important to us to be recognized as one, right? So Magnet is the highest credential any health organization can receive from ANCC. And ANCC is American Nurses Credentialing Center. And it signifies that we provide the best care that we can offer to the patients and to the family that come to our hospital. It is the gold standard of nursing excellence. And I'm happy to share that they've accepted our application. We've passed the first step of the application process, and we're moving to the site visit. Our site visit is going to be this upcoming May 13, 14, and 15. And we wanted to show and share to the public that this site visit is upcoming, and we invite the public to share comments and feedback to the credentialing center that's coming to visit us. And the purpose of the visit is for them to verify that we as an organization is providing great and quality care to our patients. That's about all I have. Then I'll call in my colleague, Deborah Hunt, who's going to be sharing some of the awards we've received.
Thank you, Ria. My name is Deborah Hunt. I'm the Director of Nursing Education here at LA General. I just wanted to share with you some awards that the Nursing Education Department has received over the past few months. The first one is, oh, thank you very much. The first one I'll talk about is the Bronze Eagle Award. The Bronze Eagle Award is awarded by the LA commissioners, and it's a quality and productivity award. And we started the nurse residency program where new graduate nurses get an onboarding process that is over 6 months, and they get intense specialized lectures and skills. And with that program, we have retained, I'm sorry, I don't have my glasses on, it's on the slide. We have educated over 400, we're actually over 500 right now, nurses over the past 2 years. And we've saved the county a lot, it's a couple $1 million, because we don't have to hire as many registry nurses and the nurses stay longer. So we received the Bronze Eagle 3rd place in all of LA County. Thank you. And our second award was from, thank you, the Association of California Nurse Leaders. And it's the first time that they have a category for team award, and our nursing department for education received the Excellence as a Team award. So we're proud to share that with you. Thank you.
Thank you so much. And congratulations to the amazing nursing department.
So my question for the magnet program that you're doing. So, because I want to know, like, it seems to be a prestigious award. How many people or how many hospitals like get it or have it?
So, thank you. So in the United States, only less than 10% of hospitals are magnet recognized. So that's how prestigious it is. Not every hospital gets to achieve this recognition. So it's something that we really have to work hard for it to, for us to be given this award.
Any other questions or comments for our incredible nursing department here at the General Medical Center, LA General Medical Center?
I have a question about the magnet as well. What is the differentiating factor? How is this different than any other type of awards that I've seen? You know, is it about service? Is it about medical care? Is it about diversity in care? Is it about different health focuses? Maybe, I don't know.
Well, Magnet is a nurse-driven recognition, right? So mainly it emphasizes the changes that nurses bring forth to the hospital to ensure that great care is provided to the patients and all the people that comes and see our hospital. It is characterized by positive patient outcomes, because we ensure that every patient that comes to the hospital gets the best care, and that you guys are able to go home and able to maintain and sustain a healthy living and lifestyle. That's part of it. It characterized as well by quality and safe care from the nurses themselves. We have nurses that are very competent and confident about their skill level that ensures that you guys are going to be receiving quality care while you are here, and they're going to be ensuring your safety while you're here. So that's what it is about. It's all in all an intercollaborative effort driven by nurses to ensure that the healthcare team is providing great care to the patients.
Thank you for your question, Ari. Any follow-up? Okay. Well, thank you so much, everyone, from our incredible leadership team from the Los Angeles General Medical Center. We really always appreciate the updates from everything that you guys are up to, and congratulations on both these awards that you've received, as well as the process you're undergoing for the magnet designation. We're very, very excited about that. Also appreciation to Dr. Spellberg for sharing with us some of, how the medical center is approaching the uncertain times we're in related to shifts in federal policy and funding as it might impact healthcare dollars that come down to the local level. So this is an ongoing conversation. We're starting it here with you today. This was a conversation initiated by request of our co-design committee, but we know that there is, more to learn and more to know as we move forward. So anticipate that we will continue these conversations over time. So I think that's our update from the medical center. Very exciting. We're going to move and pivot into our next presentation, which is by Los Angeles Metro. We're really excited to have them joining us here today to speak about the new Metrolink station that is coming our way and how that might improve access and services here at the medical center. So with that, I invite Jay Fuhrman and colleague to come to the podium. Go ahead and just use the arrows to direct the slide.
Thank you so much. Good morning, everyone. My name is Danielle Valentino with LA Metro. I'm in community relations, work on different initiatives at Metro, and we will be introducing to you Jay Fuhrman, who is our project manager on this initiative. First, just wanted to ask, how many of you know of Metro? LA Metro, raise your hand. Excellent. How many of you know Metro from riding the bus or a train? Any other services you use of LA Metro? We have all kinds of bike share. Okay, I see a couple hands go up. We help fund shuttle services, access services. We're quite involved in the mobility space in LA County. However, we want to focus your attention on Metrolink because we're actually working today, and we'll share with you information about Metrolink because we are actually looking at doing an infill station for Metrolink, which is our regional rail, commuter rail provider that is separate from Metro. However, we do work very closely with Metrolink on improvements on their system. So show of hands of how many know of Metrolink or take Metrolink. Okay, great. So there's quite a few Metrolink riders as well. So LA Metro owns right-of-way on tracks that are right here at the campus, adjacent to the medical campus, where we have an opportunity to build an infill station, which is basically adding a train station right in between the existing tracks that are already there in the existing right-of-way to better serve rail transit riders to the campus. So we're very excited for Jay to explain this project with you, but we did want to clarify that even though we're LA Metro, we are working on Metrolink infill station because they are a key partner and we do own that real estate where the tracks currently run. And we have an opportunity to create an additional mobility option for you here at LA General Medical Center. So with that, we'll turn it over to Jay, who will get into the details.
Thank you, Danielle. Good morning, everybody. Thank you for having us. Let's see. I guess I'm going to run all this presentation. Great. Got it. Thank you. Okay. Thank you for having us. It's great to be here with you this morning. As Danielle indicated, we're with Metro, and everybody knows Metro, of course, with our bus and our rail system, but the Metrolink is similar to Metrolink, the name, to Metro, the name, but it's the commuter rail. It's the big choo-choo train locomotives that go out to outlying areas from Union Station. And the line around here in particular is the San Bernardino line. So this map kind of gives you a little orientation of what we're talking about. On the left, you'll see the larger downtown Los Angeles area. And right now we're only about a mile east of Union Station, and we're about a mile west of Cal State LA. So that bluish dot there is the area near the where we are, frankly, at the medical center campus. The map on the right zooms in a little bit more, and it shows you the medical center campus and the area to the south, in particular, closer to the I-10 San Bernardino Freeway. And that reddish kind of shaded area there is along the railroad tracks for the Metrolink right-of-way. It's the area just south of your big, ginormous parking structure, I think 9D, I think it's called. And the frontage street there is called Pomeroy, and it's near State Street. And that's the area for the Metrolink. As you may know or even use, we have a Metro busway station there as well already. It's for I think it's the J line or the Silver line. I keep getting our letters and colors mixed up, but some of you may take that busway already. It goes to El Monte and it goes down actually to the South Bay and downtown. So thank you. Oh, I don't know what's going on here. Okay. Oh, okay. Great idea. So that is the current busway station. And you may have noticed that there's a railroad track right there. There's actually 3 tracks, and the Metrolink trains go by, but they do not stop there. And if they were to stop there at a Metrolink station, it would be a wonderful benefit for the hospital campus and for the community. So I'm just going to talk a little more about that. So previously, Metro did a feasibility study. We looked into the possibilities and the benefits of having this Metrolink station that would serve the medical center campus and the surrounding community. And we found kind of 4 main goals or objectives of this study. The first was to provide a reliable transit service for essential workers and visitors to the medical center. Apologies for the LAC plus USC, forgot to change that. We know it's LAGMC. The second thing is to provide mobility benefits for the residents in the surrounding community. There are a lot of residents that live nearby, particularly south of the freeway near State Street. If they had a regional rail station that would provide connectivity to Union Station right in their neighborhood, it would provide fabulous connectivity to our regional rail network, particularly once you get to Union Station. You could connect to our subway system, which is expanding, by the way, and the light rail network, including the rail with the regional connector to the Long Beach and to the east side and to Santa Monica and to Pasadena and Pomona. And again, this rail network is only expanding between now and the Olympics, particularly with the Purple Line and connections to the west side and UCLA and future rail corridors. So the connectivity would be tremendous. The other thing at Union Station, you could also connect to the Metrolink trains. There's other lines that go to Orange County, Riverside, Ventura County, Palmdale, Lancaster. And also we have a huge bus network at Union Station and connectivity to the municipal operators. So a lot of this could benefit the community with wonderful improved connectivity to Union Station. And various other benefits, such as just the overall support for the revitalization of the medical center campus and the redevelopment to support a more of a health innovation district and just make it easier for people to access this campus, including the Keck Medical Center and the whole medical community around here. And finally, as we all know, just trying to get here, there's a lot of challenges with parking and traffic and congestion. And if you drive too slow, they will honk at you, and finding parking, and it would just help with that. And also more people taking transit helps improve air quality and greenhouse gas benefits, which we all know about because this is a medical center friendly health community. And we all want to have better air quality. So those are some of the project backgrounds. We did a feasibility study. It was completed in 2022. And it basically said, yes, there are a lot of benefits to doing a Metrolink station. You would probably have several hundred riders a day that would use that station. And the connectivity, to the campus. Obviously, it depends where in the medical center campus you're going. If you're going to this building or this area, it's a shorter walk. If you're going more to the USC side, obviously it's a longer walk. So, there's some pedestrian connectivity things to be looked at, but you already have a wonderful pedestrian bridge that takes you from that parking structure right into this main area here. So, in terms of the goals and the timeline, basically, we did a feasibility study, and with the support in particular of the supervisor's office. I don't know if Supervisor District 1 is here. There you are. Thank you. Hi, welcome. Thank you in particular to the support of your boss, who also sits on the Metro and the Metrolink boards. She was very supportive that we study, the possibility of a Metrolink station. And then, because we did the feasibility study, they were even more supportive to help us get funding to go into this next phase, which is the environmental clearance and 30% design of a station. So that's really what we're at this stage now. And in terms of some of this, I may have mentioned earlier, apologies, but in terms of the objectives that we've given to our consultant, it's to look at just improved rail accessibility to one of the largest, hospitals in the nation, obviously, and provide connectivity to the neighborhood as well. And we're going to do environmental analysis and technical studies. And we think that the project would likely or potentially or presumably qualify for what we call a categorical exemption through the California Environmental Quality Act. In other words, we wouldn't have to do a full-blown environmental document. It would hopefully get an exemption because it's in an existing active railroad corridor. And we still have to do technical studies, but it's not as involved as other projects. So hopefully it would qualify for that. And then we would complete 5% design. I'm going to show you this in a second. We have some very, how shall I say it, cool renderings, photos, concepts of what the station might look like. And we're going to do kind of some high-level design of a couple of stations. One is more basic, the other is a little more fancy. And then we're going to do the 30% more advanced design for the more basic station at this time, because it comes down to money. And the fancy station costs a lot more money. This project we're in right now, the environmental clearance and 30% design, is about a 12-month effort. We started really in January because of the holidays, and we kind of got going in February, and we're involved in a lot of the preliminary environmental work and engineering. You'll see a schedule in a minute, and we hope to wrap up the work by the end of the year, like in November, December. And it's about a 12-month effort, give or take. So this already is one fairly cool concept of what the station might look like. It's kind of looking east, and there's an existing pedestrian bridge that takes you to the busway, and we'd have another bridge next to it. We have some better photos you'll see in a second, but you can see it could be a hub with a lot of activity. It would have to have a lot of level boarding because you've got a lot of people with mobility challenges. It would have nice elevators, and it would, have a lot of level boarding to the trains, and it would be well lit and have nice, welcoming kind of amenities for riders. But we have better pictures to show you coming up, so stay tuned. On the next slide here, we're going to just zoom in a little more. This yellowish area is the area we're talking about. So if you look down at the bottom left, you can actually kind of see the busway. And the busway station has a ped bridge, and this is just east of State Street. And there's a pedestrian bridge right now that basically takes you from Pomeroy near the parking structure, and it takes you across 3 Metrolink train tracks to the busway. And again, this is not the tracks by Valley Boulevard on the other side. This is along the San Bernardino line. If you look in the bottom left corner, you can even see part of the freeway, and you can see bus lanes and our busway station. And you can also, not only does Metro serve the bus station now, but also some of you may take Foothill Transit, which I think stops there as well. But this is the general area. Metro owns the right-of-way. Danielle would be upset if I didn't remind you that in terms of Metro's role in this, we're very involved because we own the right of way and we provide the majority of the funding to Metrolink. And we also politically, the supervisor sits on the Metro board and the Metrolink board. And Metrolink is the operator, but they don't really have any money of their own directly. So they look to Metro to support, advancing these types of projects. So this is where kind of the footprint where a station could go that we've identified. And you can see it's near the medical center campus. It's not right next to it, although it is next to the parking structure. And it would be a great opportunity to provide connectivity to the campus and the community. The next slide is kind of cool, I think. This is our standard station. And this concept shows you what a station might look like. This is the more basic station. And if you look at those greenish little, structures, those are the canopies. That's where you go, obviously, when it's rainy or hot. And we like to provide shade because it seems to only be getting hotter around LA and the world. So those would provide some shade, and there would be an elevator. And I don't know that we show it too well here. I think it's better on the next slide, but there would be an elevator up. Well, I guess we don't show it because where it says new pedestrian bridge is where that bridge would go. And there would be a bridge kind of just next to the current bridge, to the busway, and there would be an elevator and stairs, and it would take you to this other bridge, which you'll see better in a minute. And then you would take that bridge up to Pomeroy, and from there you could go on the sidewalk, or if you wanted to go, you could go through the parking structure across the Ped Bridge and eventually make your way into the medical center campus. Another opportunity, because we like redundancy, particularly if an elevator goes down, particularly serving a hospital, is to have another access point. If you look in the bottom right corner, there would be what we call an at-grade crossing, and there would be a ramp. It would all be ADA compliant, by the way, with kind of landings and level boarding areas. But this is another concept. So there would be two access points to the station. One would be the main one over by Pomeroy by the parking structure. The other would presumably be this at-grade crossing down here. And it might be landscaped nicely and be a nice, welcoming, inviting kind of opportunity. So this is the more basic station, but you can see would be two Metrolink tracks, one in each direction, and it would be next to the busway. So really, in essence, what we would be creating here, like it or not, is what we call a mobility hub. And you would have a lot of connections here. You would continue to have the J line. I'm J, no pun intended, but it's the J line busway, and you'd have the commuter rail. And again, to remind everybody, the commuter rail goes to the east to Cal State LA, El Monte, Pomona, and eventually Rancho Cucamonga and San Bernardino. And to the west, the next station is Union Station, which basically connects to the world. So, in my opinion, so this is one kind of, and then you've also got buses that serve the area on Pomeroy where those eucalyptus trees are. There's Metro buses. I think we have 4 bus routes, and there's also local shuttles. So this would be really kind of a mobility hub. And then here is a couple of concepts for what we call the signature station. This is the fancy station. The footprint is the same. The difference is the canopy. So the canopy structure is this very interesting, architecturally welcoming structure. It has a lot more shade. It has interesting, even innovative lighting. And it would be really cool to have a station like this. It's obviously more costly, but this is a concept for what the fancier station might look like. And if you look in the top right corner, and it's a little bit hard to see here, but you can see kind of the existing bridge over to the busway, and then where this other bridge would be next to it that would drop down onto this platform. So I'm going to show you another angle on that in a second. And in case you're wondering, why do we need to have 2 bridges? Why can't we just have 1 bridge? If you touch that current pedestrian bridge, there's a lot of engineering structural issues, and the integrity could be compromised. And if you mess with that current bridge, you might also mess with the busway station, because that bridge connects to an elevator and stairs. And this is a project to do a Metrolink station, not to do a big busway kind of retrofit. So we try to want to limit the project to just the Metrolink station. And because of the engineering issues with the loads of the bridge, you compromise the integrity. So we have a second bridge right next to the current bridge, but there's a way we could do it where it would still be very easy for the rider. And you're going to see that right now. So this might look familiar to you, sort of. The bridge on the right where it says 2 express buses. By the way, this is just one concept. It may not look exactly like this, but this is just like a representation. So the bridge on the right is the current bridge, and that takes you to the busway. And if you look on the left, you can just see a little bit of the edge of the parking structure. And again, this is Pomeroy Avenue. So we would have another bridge next to it. I think that's where it says to rail transit. And that bridge on the left, so to speak, would go about half the length of the other bridge, and it would drop you down onto this platform. And you can even see a Metrolink train, I think kind of in the back there. That bluish color would be a Metrolink train. You can sort of see the busway station. And of course, behind it is the freeway. So this could be a welcoming entrance point to the campus. We could have a little cafe or some retail or some amenities. It would all be ADA compliant. And if you look to the left, you can see one of your shuttle buses, I think. And there's some metro buses that stop there now. There may be an opportunity to put in a more inviting kind of a bus connectivity there as well. So this is, one vision of what it might look like. So we're coming towards the end of our presentation, but I wanted to talk to you a little bit about the schedule. So right now we started really back in November, December, and they recently did some traffic studies to do traffic counts of vehicles and pedestrians. And they're really about to start on the environmental work very soon. And that's going to last about 6 months. There's a lot of technical studies they do to look at noise and cultural impacts and environmental and neighborhood impacts, even air quality. They look at a lot of things. And generally, we think that the project would likely qualify for a categorical exclusion because it's in the railroad right away, and there's certain allowances for that. And the overall benefits of the project presumably far outweigh any negative impacts. So we think it will be very well received. And this is kind of the environmental schedule. And they will go more into the 30% design in the late summer and fall and wrap up the project hopefully by November, December. We will get to outreach in a second. So some of the early things we've already done, this is a little more technical, but we did some survey work to kind of survey the railroad right away to get all the markers and locations down because engineers need that. They've been doing some utility searches of Sprint and fiber optics and things along the right of way. We've had at least 1 or 2 site visits to go take photos and look at the conditions. And we've started some engagement with key stakeholders already, such as Metrolink, the City of LA Bureau of Engineering. I don't know if the city is here or maybe the council member's office. We've been working to coordinate on other projects. There's another Metrolink project nearby at Marengo Street, and the City of LA is actually planning to widen State Street. We've been working on some real estate issues just to kind of coordinate on nearby structures and things like that. And we are working on the feasibility study, moving in towards the draft 5% concept design. So I wanted to talk a little bit about outreach and then wrap it up. And of course, Danielle and I can take any questions. They're doing architectural layouts, the engineers, and track geometries and coordinating closely with Metrolink and even Metro on some of our Metro projects around here. And there will no doubt be public engagement. We don't know exactly when we're planning because a lot of it depends upon the schedule with the conceptual design and the environmental studies. But I would say that we're planning to do some outreach, obviously, this fall. Can't really tell you any more at this point, the dates and all, but we certainly want to listen to you and get your feedback and your thoughts. But I would say maybe September-ish. Don't quote us on that, but that's when we would do community outreach. And definitely want to present things to the community at that time, because if we had outreach now, it would be kind of too early. We wouldn't have as much to share with you. So we plan to do more of the engineering and share some real kind of engineering and results of the environmental assessment with you when we have more information, shall we say, this fall. That's really it for now. And it's just kind of a high level overview. Danielle and I just want to thank you for giving us the opportunity to be here. And we'd certainly be glad to take any questions you may have.
Great. Thank you so much. Do we have any questions in the room? Yes.
So I have two comments. What are you going to do as far as, because there are people that stay there, they're houseless, right? To support them when this project is happening, because I work in homelessness and I've housed some of the people in the past that have stayed there, but housing is very limited. It's very hard to help people. But what is Metro doing to help? Because I know Metro has housing and can provide some of that stuff. So I wonder if there could be like some sort of program to help the people there specifically, because what's going to happen if they'll be harassed enough to move and they're just going to go up on the street, or they're going to go in the other area in other areas. So they're just going to be in the same situation, just moved. So that's one. The other thing that's bothering me, when you're talking about environmental studies and you want to get a waiver, and it, to me, and I always support a lot of the stuff that supervisor is doing, and I was in favor of this, but when you're speaking about, you want to get a waiver and, it outweighs any negatives, the negative to me seems that, is it at the risk of the people that live there, their health? Because there's going to be more traffic, right? So I just want to make sure that when we're doing these environmental studies, we're not leapfrogging and not looking at those things, because I work right by there. All of us work, well, not everybody, but you know what I mean? I want to make sure that we're not skipping steps to make sure that this happens when it could really affect the health and well-being of the people, because this is a health facility, right? And we want to make sure that we're protecting. So it's just, I don't know if it's just the way you're saying it that's bothering me, or maybe, and maybe that's not what you mean. So I'm trying to give you an opportunity to speak on that.
Yeah, maybe Danielle can chime in.
I'll try. Thank you for the good question. And I'll start with the environmental study question. That's a very good, excellent observation. I think when Jay mentioned the CE, the categorical exemption, essentially there's an option under state law. We don't know. I don't think Jay and the technical team know if it will apply here, where they can potentially do more expedited, if you will, maybe not as thorough or as robust, if you will, of all the studies, because they're looking at putting an infill station on an existing track that's already there. So when you're building like a new rail track, for example, like a brand new rail corridor that's not already there, when you're trying to build brand new, transit corridor with new track, you have to do a lot of studies for years and years and years, right? Because you're going to have to, in that context of a brand new corridor with new track, you have to study all of the potential properties that may be impacted. In this case, I think what Jay was trying to say, and forgive me if I get it wrong, the track's already there. It's been built a long time. So the idea is that with that one slide, the idea is that they would put with the agencies would put an existing they would put a station at an already existing track. So let me go back to that. So that is already built. So everything you're seeing in this photograph is already there. And so those canopies would go right in between two tracks so that people could like have some shade and be able to hop on the train. It wouldn't be something that would require going outside of the trackway. So I think from that standpoint, we don't think it would require all the same levels of technical studies as if we were building a new track and a new everything. However, to your good point, we could definitely take down any suggestions of studies you'd like us to consider looking at, because we definitely have an opportunity in these next 12 months or more to really do a thorough analysis of any type of impact concerns too.
Yeah, and I think what you were just elevating maybe answers a lot of the question that Monica was, I think, trying to raise, which is if there's no new, if the only new traffic that's coming through the area is pedestrian traffic, because right now the trains are already happening, then maybe there isn't any additional environmental impact of the structure itself. But I think understanding that was, I think to Monica's point, you know, if a new trains were coming in, or if a different type of, the train had a different type of fuel or something like that, like what are those environmental impacts, I think is what we were trying to understand. But maybe really the answer is like, hey, since we're building on an existing line, we're not actually adding, you know, additional train flow or anything else, or maybe we are. And if we are, what would I think those environmental, those health repercussion, environmental impacts. That's kind of what I think I heard from Monica.
It really bothers me. I'm sorry. It's just a lot of times, you know, when you say something, I'm looking at it like, it seems like the environmental stuff, we can get a waiver to not have to do X, Y, and Z. But if you explain it a little more like how she said it, but then saying outweighs the negative, well, I want to know what the negative is, because it's going to impact the people that are there. There's families that live there, the community. And we already know that Boyle Heights and all the, you know, these kind of communities, you know, have been treated because of who lives here a certain way. So I just want to make sure that, you know, when if you're conveying to what are the negatives? Negatives are, I don't know what the negatives are, right? But when you say it like that, to me, it's like you're diminishing the people that are here, right? And I'm not saying that that's what that's what you were trying to say, or like what the negatives are. But if you're telling me the negative is, there's just going to be more pedestrian traffic, I don't know what the negative would be. So that's where I have the issue, right? And again, I think I personally, I listen to what people are saying a lot. And I'm wondering, because I'm thinking about the people that are homeless in that area. And I know I'm for it, but what are we going to do to make sure that they're taken care of? And in this climate, it's hard already, just in general, before the administration, it's going to be even harder. We know that a lot of things are coming. I mean, with the hospital, even like the money coming. So, and I know Metro does have a lot of things that they can do. I wish Metro was doing more to help that population just in general, but I'm talking about the people there. But so those two things, I mean, I'm giving you the benefit of the doubt, but it's just, I think if you explain it a little better, especially when you go out into community, it's important that you say the negatives could be X, Y, and Z, or we don't really know, but it's not going to bring more trains, or so that's not going to be more or less it, right? Am I making sense?
Yeah, it's an excellent point. And I think what Monica's elevating, and one of the reasons the Health Innovation Community Partnership exists, is because this community has been not included in the conversations historically in a lot of cases. Right. And when you hear things like, oh, we're going to kind of shortchange the environmental review, that has happened in the past with very negative ramifications for this local community. Yeah. So just rephrasing and again, technical language, you guys know exactly what it means from your point of view, but we don't have the benefit of all of that detail. So, just we'll find our way together to kind of find some language that is a little more accessible and understandable to the community. And I definitely want to invite you guys back in the fall when you do more of the community engagement, not just to this body, but to some of the other groups that we work with in the local community. Yes. We would love that. Yes. But we would also love to lean into people like Monica, who sits on our co-design committee, to help develop the materials to present to the community, because she's an absolute expert at helping guide the conversation.
Oh, that would be wonderful. Thank you for that. And I would like to just add to your good point about homelessness concerns too. We just are getting a team on board for we actually just started. I had our first meeting with our outreach team that's just starting. So you'll see a lot more rollout of a website and materials soon. We're still with the technical team's renderings and work. So we will have that opportunity to kind of revamp our materials as well. I just want to share on the homelessness front, though, LA Metro, which is again not Metrolink, LA Metro has a host of programs that we are working on that, to your good point, are really focused on how do we meet our riders and our unhoused population right where they're at. So even on our train systems and buses, for quite a number of years now, we've been working with wraparound teams, like with social workers and social service workers in tandem with first responders to find the folks who are unhoused, riding on our system, to make sure we're offering them services and like holistic approach to how to get help and resources so that they're not hopefully punitive in riding the system. And so there's a lot of information we can bring you just about, Metro's approach to how we're trying to help bring resources to our transit riders so that they know of their options for finding housing and hopefully not having to stay in that situation. So we can bring you that information as well.
I'm very, myself, I have a lot of knowledge in that. So I've actually was tapped in to try to lead one of those teams. So I'm very aware of like the programs of the riderships and everything that you're doing, but I'm specifically talking about the people that live on that stretch and just on, that live on Metro property or so that's what I'm saying. I think this would also be a great opportunity to bring back and see like you have housing and you have property that we can build housing on. I'm just bringing another aspect of that. This could, I think that would be one of the best things you can do, because I used to go to the Metro meetings downtown at Union Station and we would bring those up, but it just seems that it's like kind of pushed, but I'm just.
No, thank you. Thank you. And another great thing you raised, just for broader awareness of LA Metro, again, not Metrolink Station, Metro. Metro has another program that's trying to have like 10,000 units of affordable housing. So we have LA Metro has a very aggressive and exciting program to co-locate affordable housing units adjacent to transit stations. So to your good point, we have sort of a multi-pronged approach at Metro of how we're trying to tackle the issues. And so one of the big items is co-locating affordable housing and reaching like 10,000 units essentially countywide towards this goal of affordable housing near transit. So we do look at a lot of our transit friendly areas and transit stations for opportunities for more of that as well. And lastly, I'll just end with where our environmental study process will allow us, to your other good point, to really study impacts. So we should really be clear with that the purpose of the environmental study we're about to embark on is to assess impacts and to assess, impacts are both positive and negative, and make sure that if there's negative impacts, we identify those and then we can properly mitigate and address that. So that's part of the process we'll be embarking on. And we should not shortchange that, because we will not be shortchanging that. And it's also part of the process we're going to start. So thank you for the good insight. Any other questions we can help with?
Do we have any other questions from within the room?
Hola, buenos días. Mi nombre es Alejandro Castro.
Good morning. My name is Alejandro Castro.
Y junto con varias compañeras en un grupo.
Along with some of my colleagues,
y hemos encontrado con
we
una
found
comunidad o comunidades
in our
muy heridas.
community are very hurt communities.
Y el resultado de esas heridas son
And the result of this is, the homeless
entonces
situation.
ahora con este proyecto yo lo
With
veo que
this
es fenomenal,
project, I think it's phenomenal,
muy bueno.
very good.
Y ahora solamente yo quisiera decir que me
Now,
gustaría,
just want to say that I would like,
ojalá que pudiera
hopefully,
apoyarnos la seguridad para las familias
support and the security for families
que van a transitar en este proyecto.
that will
Muchas
be
gracias.
using this project. Thank you so much.
Great. Thank you. Yes, thank you for that. We Yeah, and the security is a very important issue. We know that both LA Metro and Metrolink do have their approach for how they handle safety. And so, for LA Metro, you have, if those of you who ride the J line, we do have, as I mentioned, first responders. We do have law enforcement who do what they can to uphold security. However, they also partner closely with wraparound teams to help identify folks who need resources, who may be riding the system because they don't have another option. They may be unhoused. And so we do what we can to identify those individuals who really aren't riding to get from point A to B. They're riding maybe for sheltering reasons and trying to find them shelter and resources to better address their needs. So thank you for that. Security will be a top issue as well.
Any other questions? Oh,
Hi, good morning, everyone. Guadalupe with Supervisor Solis's office. I'm very happy to hear all the comments that have been expressed. I think these are very, there was a previous presentation quite some time ago. So this is great that you're coming back and sharing, the updated concept, and also, in regards to, the different touch points that this project provides. It is meant as part of the, everything that we're doing at the LA General Medical Campus. The idea is to re-envision it and into a healthy village vision that is shared by the community and supervisor. And that is what we're very hard, to deliver with the community. And so part of this concept is to also address improving access and transportation to the campus, which this project, that's one of the reasons why, I think we are very supportive that this brings that benefit, right? In addition to addressing, I think everything that was said is very valid. We need to address how we, work and address our unhoused that are in proximity to the proposed station, as well as addressing safety, pedestrian safety. And I think those are some of the things that we have been as well, all talking about as we're working on this project. And so we're very, confident that we will be addressing these points as we move forward. And again, it's very important, not just for the communities surrounding that will benefit in using, this, public transit option, but also for the employees that are at LA General. It is also going to be a benefit. And overall, having this option reduces, the need for cars and, impacting their quality further, that this community has already been, impacted by. And so we see a lot of benefits, but again, very valid points that were raised today. And we're very hopeful that we will be, working through appropriately all those points. Thank you.
Thank you very much for your office's support. And as mentioned, Supervisor Solis on the Metrolink board and Metro board, and being a champion for the community always. And we really appreciate that. And we do think that this campus serves thousands and thousands of people. It'll be really exciting to get the data on that from Jay. So, this improvement really stands to benefit certainly the people commuting every day into work from maybe further east or all parts of the county and the region who commute here in their vehicle. Hopefully they have another option to get here with just taking the train. And so we do see that as going to be a really game changer for employees and as well as the community to use the station. And then hopefully the station design and lighting, once it gets further down in design, the opportunity for lighting and illumination in terms of the good points made about safety. It's often environmental design also, right? That helps safety. And so when you have a lot of movement of people and activation of a space, that helps eyes and ears on the ground. It helps safety. So being able to activate the space with a station to help have more of people and eyes and ears out there is also a really great opportunity for safety. And of course, lighting features and all the features that come with the station for illumination should be another value added for that. Thank you. We really And let us know, we'll have our contact cards, any ideas for key organizations, key people you'd like us to follow up with. While we don't have a lot of data yet, right? We're just getting started on the environmental studies, and we do have this information at high level. So, we are available to share this information in the days ahead and weeks ahead. Should you suggest other organizations to speak with until we're ready with our environmental analysis to share. So thank you again. Appreciate all the questions.
We have 2 questions from the Zoom, if you don't mind sticking for one more minute. Ari, would you like to ask your question?
Yes, I wanted to highlight that number one mentioned lighting and all that good stuff. And I noticed from an environmental standpoint that I don't see like solar power being put on those roofs that are being designed. Maybe that would be an opportunity to kind of be environmentally friendly and responsible at the same time as providing more lighting and all those type of facilities. Also making sure that there's things like Wi-Fi and all those amenities that these passengers could utilize, and it should be free. And second, and also there is mention of, the bus shuttle could stop there, but I think it might be expanded a little more to kind of think it from what the multimodal space could look like, especially as we are looking at other projects near the campus that do have that multimodal plan, and space and plan. So, where cars and bicycles would easily be able to come in and out, and really kind of think that through from that perspective. And all the connections that are happening over there could be happening here as well. The other thing in terms of the environmental study and what impact there could be to the community, I know that when there was an intention, or rather a suggestion to build a tunnel for the 710 freeway, there were some fans or some sort of way of treating the pollution that would come from the cars or the trains, so that it would clean the air. And so maybe that is something, especially if we're increasing the amount of not just train traffic, but also bus traffic and so on, that we would build into the plan a way of being more environmentally friendly to the community in terms of pollution. Finally, I wanted to ask or see how this project can be connected to the 710 didn't happen extension project that didn't happen. And I believe that there is something happened on the other side on Valley regarding that. But I happen to live in Alhambra, and so I believe Alhambra and City of Monterey Park and other cities affected also are connected to that planning. And so I'm wondering if, for example, the station at Cal State LA, which was mentioned in your presentation, could also be enhanced in terms of a multimodal center, and hopefully being able to help people get to Union Station, get to the light rail stations, and be more successful in the plan overall in terms of getting public transportation to be used more.
Well, great. Thank you so much for that. Very thoughtful, really thoughtful feedback. I'll touch on a couple and let Jay touch on the others. I wanted to touch on the transit-free suggestion, I think is what I heard. We don't currently have with Metrolink, because we're talking about a Metrolink. It is not a free system. So just to be transparent about that. At the same time, there's some really exciting discounted fare programs that our agencies do offer. So we also have the J line right here, the silver line. So a lot of you are curious to know how many people take the J line. It's a very, very popular rapid busway that Metro does. So we have things called the Life program, We have the Go Pass program. We have just a plethora of different services that are geared for very discounted fares. So I'd love to get you in touch with our folks who do that. We could bring that information and share it on a slide. We have really wonderful programs for really, really low base fares. So a lot more information on that from Metro that does apply actually to our partnering transit agencies as well. So a number of those do involve or invoke our other operators where they are applicable for those discounted fares. If you're a transit rider going from the J line to Metrolink to the purple line, the red line, or the B line, you can have some interoperability with those discounted fares. So we can get you information on that and make sure that you're aware of those. We have a free fare program for students. So if you're a student, you can if your school district is participating, you can get a really cool like free fare essentially if your school is qualified and participating in that program. So again, we'll be happy to bring info on that. And then for the connectivity, multimodal connectivity, I know there's thoughts about that, and I'll talk to Jay may have more information about Cal State LA and the 710 nexus there.
Sure. Just a couple of quick points because I know you've got other things to get onto. In terms of the first comment, I think there was a comment regarding solar panels, and we can certainly look at that as part of the design. There's a lot of opportunities to kind of recapture renewable energy through panels. So we will definitely look at that. Thank you for that excellent comment. And then to the comment also about Cal State LA, just in general, I think the comment was sort of along the lines of what we call first last mile active transportation. We'll definitely look at opportunities to improve pedestrian connectivity and even bicycle connectivity and what we can do to kind of make it what I referred to as a multimodal hub. There are some challenges here because you're sort of kind of confined with the freeway, literally, and a busway and the hill. There's an elevational issue. There's a giant parking structure, which isn't that inviting. So there isn't a lot to work with here, but obviously there's a railroad corridor that doesn't stop there. And if there was a station, that would provide a lot of rail accessibility and connectivity ultimately to the regional network. As far as Cal State LA is nearby. They actually have quite a nice active metro bus stop there at the top of the station. And it's actually one of the most heavily utilized Metrolink stations, and it's nearby. So we'll look at kind of the nexus with or accessibility with Cal State LA as well. That's a really good suggestion. So those are my thoughts for now. But the study's just getting going, so we're going to look more into these things. Thank you for the questions.
Yes, thank you so much for the presentation. I know we had a hand raised from Pam. Is that still up, or have you taken back your question at this point, Pam?
No, it was still up. Hi,
okay.
Everyone. Can folks hear me okay? Yeah. Okay, cool. I hear.
Hi, Pam. If you could keep it tight, that would be amazing because we are running a little bit behind schedule.
Yeah. No, I just wanted to, first of all, because I'm online, emphasize that I really appreciate Monica's expertise and the concerns that she raised. And for our partners here presenting today, just want to also state that the positive thing about this space, HICP, is that we can always create concrete plans to address the concerns that our partners raise here. Because if our partners have these concerns, it is likely coming from also the community that we work on the day-to-day basis. So I think for me, from my point of view and the work that I do, which is working with tenants, I think we need a plan, or your organization needs to create a plan on how you're going to do consistent outreach to houseless neighbors, how and what dates and what times. Like, what I mean by consistency is like with dates, times, and an assigned individual on your team that these partnership can also go to make referrals beyond just telling us there are these existing programs and here's a number and a flyer. I think we want to be more proactive in this space on how we address the concerns so that we do development in a different way and we convey to the county in the region as a whole that alternative methods of development can be done. So again, I appreciate all of the resources that you've identified that are out there, but I think we need an individual, a team that can consistently be providing that as your project continues, that we as partners can connect to, the community can connect to, and we can, have clear solutions for people impacted. And if you haven't been able to read it, just highlighting that our partners also put comments in the chat. And lastly, how should we give your team feedback? If we still, chew on all of the information you provided, what's the best? Send maybe a comment letter or a comment email to you. Thank you.
Thank you, Pam. Yes, and I did want to elevate that we do have some comments in the chat. I think you have addressed much of what was spoken about in the chat. There was questions about security and also about affordability of ridership and opportunities for reduced fare access. There was also a comment about maybe free Wi-Fi at the area. And I think Daniel Jimenez raised something that I thought was really interesting, was this notion of bringing culture and community identity into the space. And that is something that I know this body has been very devoted to in terms of public art, even color schemes that speak to the community and the neighborhood, and trying to reflect that wherever possible, so that the resources that are provided to this community from the government really reflect community identity and embrace the community to come and participate. So I think that's a lot of what was addressed there. I think to Pam's point, if you do have some best ways for us to connect with you, please share that out. We will put that in the chat right now, and we can certainly, invite people to share more information. Again, we would love to invite you to come back as more is known, and to really lean on us as partners to help you connect with the local community, because I know we would really, love that opportunity to continue the dialogue about this project. So,
thank you.
Thank you. We'll be happy to. We're building a website, so stay tuned. Our website will have, basic ways to reach us. However, in the interim, you can certainly email us and send us any comments, letters we could consider ahead of us getting going. My email is valentinod@metro.net, and Jay is Fuhrmanj.
Yes.
Our project manager for this initiative, Jay Fuhrman, is Fuhrmanj@metro.net. So while we get our email and website built, you can reach out and send us comments there too.
We'll go ahead and put that in the chat right now. We'll send it out as part of the materials for the meeting as well. Yes, absolutely.
Thank you, everybody, for having us.
Yeah, thank you so much for the presentation. Obviously, a lot of interest. We're very excited. So we are running a bit behind schedule, but I'm super delighted to invite Ruth Rivera from the East Los Angeles Women's Center to come up to the podium and share with us some information about their wonderful programs and activities in this month of April, Sexual Assault Awareness Month. Ruth, please take it away.
Good morning, everyone. Yes, my name is Ruth Rivera. I'm with the East Los Angeles Women's Center. And today we're going to talk about sexual assault and Sexual Assault Awareness Month. So what is sexual assault? Sexual assault, as you can see here, I'm not going to go over every single one of them, but it could be something as sexual harassment, voyeurism, to the complete extent of rape. So this is the reason why we are here. Sexual assault, unfortunately, is not just something that is literally local or anything like that. It affects everything. It affects locally, it affects nationally, it affects internationally. If you look at the statistics right here, you see that 81% is women who have gone through sexual violence in their lifetime, 43% is men, and 47% is trans folk as well. So we see that it affects everybody. And one statistic that we did not include in this, which is actually one of the saddest ones to include, is about children. So according to the Rape and Incest National Network, it is actually every 9 minutes a child actually has gone through sexual assault. So for us, it's really important to be talking about this, because as we can see, it doesn't just directly affect some individuals, it directly affects folks as well. So for us, this organization, I'm going to talk a little bit of the East Los Angeles Women's Center. If you don't know who we are, we have actually been active in the community for the last 49 years. We're going to be celebrating our 50th year next year, so we're really excited about that.
We actually were the first bilingual hotline in the nation to be able to provide services for sexual assault survivors in English and in Spanish. So we always talk about that because we carry that as a badge of honor. Our services have been able to also include domestic violence, human trafficking, and HIV navigation as well. This lovely lady you see here is Vanessa Marroquin, and she is now our fiscal associate. But before that, she was our volunteer coordinator. And it's going to give you a little preview into what our campaign is. So just to reiterate our services, all of our services are free of charge. We do not ask for any form of legal documentation or anything like that. We really just want to get the community the help that they need and get them on their healing journey. We focus on men. So although we are the East Los Angeles Women's Center, I always like to say that we do provide services for men. We have our support services, our individual therapy as well. We have prevention services, including our HIV navigation, which we do have a navigator come to the Wellness Center every Wednesday from 9 a.m. to 1 p.m. And we also provide our youth prevention services as well. And we will have a summit coming up, and I will let everybody know once we have everything situated in the future, so we're able to invite all of you in the community as well. So what is Sexual Assault Awareness Month? So just like every movement, it starts in little ripples. It was first Sexual Assault Awareness Week, and then finally in 2001, it became Sexual Assault Awareness Month. We chose the color teal to be able to represent that awareness. And that is why I'm wearing this today. And then also, these are some of the highlighted. I ask for consent, and then Es mi cuerpo, son mis derechos have been some of the national campaigns that they've been going on. In 1999, though, one of our sister organizations, Peace Over Violence, actually started Denim Day. And that goes back to an Italian case that actually said that because the girls' jeans were so tight, that's the reason why they could not have not consented for sexual relations with the perpetrator who actually had raped her. So because of that, and now it became not just a national or local thing, it actually is an international movement as well. So for us, we also decided as an organization, what is our stance? What can our campaign be during this month? And this is where we came up with Red Lips, Hoops On, Invincible. Who I am and what I wear does not justify sexual violence. And the reason we came up with this campaign is because we have seen that a lot of the time, especially in communities of color, wearing red lipstick or wearing hoops have always been such tied to negative stereotypes. So for us, we like to dispel those myths. We like to talk about, wearing the color red doesn't mean that you're insinuating anything. It's just, it makes you feel powerful sometimes. You just want to put on that bold red lipstick. Or wearing a hoop earring isn't not professional. It's actually you making a statement of who you are and being unapologetic about it. So our campaign started with Gabby, who is right there, Gabby Orozco. She is one of our HIV navigators. And when we launched the campaign 4 years ago, we had this beautiful earring that she's wearing. It's called Poderosa on the side, or powerful. And that's what kind of inspired us to continue on with this campaign and see that there is a significance out in the community. So how can you be part of this campaign? So what we like for you to do is to be able to join us on our social media movement that we have. We would like to see your beautiful faces as well with your hoops. Doesn't matter what size, doesn't matter what shade of red you're going to be wearing either, but we just want you to put on what makes you feel powerful when you put your red lipstick and your hoops on as well. We want to see if maybe you want to highlight somebody who has been wearing red lipsticks and hoops, and also talk about why they are invincible in your eyes as well in the community. So this is Zuli as well. This was our 2023 advocate that was featured. We have featured a staff member every single year. And how can you be involved in our organization as well is being part of the movement as well, being part of that change. So becoming a promotora, for example, being one of our 7 collectives, we're all located around different parts of LA County. We even have an industrial workers collective, which is amazing. And then we also have our volunteer program as well, that you can to take a 70-hour training, get certified by the state of California, and then you're able to partake in our hotline or hospital accompaniments. We do provide hospital accompaniments here at LA General Medical Center. We've been coming here since 1979. And since we are co-located inside of the Wellness Center, we actually have been able to do accompaniments during the daytime as well as quickly as 15 to 20 minutes. So we encourage everybody that if you do have a patient that's here at the hospital and is going through something like sexual assault, domestic violence,
or human trafficking, give us a call. We're more than happy to come talk to you about it and consult. And then lastly, it's a little bit embarrassing, but this year I was named the face of the campaign. So completely surprised. But please follow the QR code that is right there. If you would like to join, we will have amazing events throughout the whole month of April. We will be having virtual content as well that you can join in through our Zooms. We have amazing workshops that are open to the community. And lastly, we have our Cumbia in the Park event on the 27th. In City Park in Montebello. We'll be having a fun time. You bring your picnic, your family, your loved ones will provide the entertainment. And that stems back to, because sometimes when women or men get sexually assaulted, the first thing is, what were you wearing? How were you moving? What you brought it onto yourselves. So for us, we want to bring a safe environment to be able to really fully enjoy, be yourself, come join us. You're with your red lipstick and your hoops, and we're more than happy to have you join us. So thank you.
Thank you so much.
So I have some stuff to give away.
Oh, fantastic. And giveaways too. Thank you. Yeah, thank you so much, Ruth, for the presentation. We'll leave this slide up during our break. Does anyone have any questions for Ruth? Oh, in the back.
It's not a question.
Buenos días, mi nombre es Edith Aguilar. Quiero
Good
preguntar,
morning. My name is Edith Aguilar.
quiero preguntar, cuando una persona
I'd like
necesita
to ask
ayuda,
if a person needs help,
pero no tiene teléfono, ¿cómo
but the
podemos
person doesn't
ayudarlo?
have a phone, how can we help this person?
Si no tiene teléfono, lo que puede hacer es venir a nuestra oficina.
If the person doesn't have a phone,
Tenemos diferentes localidades
the
donde
person can come to the locations we are located.
estamos aquí en el Centro de Bienestar.
We're here in the Wellness Center,
Estamos en nuestra oficina principal en Atlantic
the main office in Atlantic,
y también en el colegio
and
de East LA
also
College.
East Lake College.
So, si ellos no tienen teléfono, pueden venir hacia
If they don't
nosotros
have a phone, they can come over
y a ver si podemos ver una manera de cómo conseguirles un teléfono. Tal
and
vez,
we can get them a phone, maybe
so, tal vez por medio de si tienen medical, siempre les
through
recomendamos
medical, could
que
be.
vayan a los kioscos donde están
We
regalando
always
los
recommend they reach out to the kiosks so they can get some resources there.
Great. Thank you so much, Ruth, again. Please share the materials out with everyone. If you have additional questions for Ruth, please join her in the room. And of course, visit the East Los Angeles Women's Center website for all of the information. You can get that through the QR code as well. Okay, we're going to take a couple minutes only. Quick little break. Just refresh yourself, grab some coffee, grab some food, let our interpreters take a breather. And we will be restarting in about so it is now 10:14. I'm going to ask if we can be back at about 3 minutes so we can get started just before 10:20. Thanks so much. All right, everyone. If you could please regain your seats, we're going to go ahead and jump back into the next set of presentations. We're delighted to be spending the rest of our time together talking about the campus projects. And we're very excited to start with a presentation by LA Habilitation House. So like I say, please come back to grab your seats and we'll get started in just 1 minute. Okay, great. Thank you so much again for joining us. It is my distinct pleasure to welcome Nancy Albin from LA Habilitation House. LA Habilitation House is the workforce development partner that is working with Century Housing as part of the permanent supportive housing project known as the Restorative Care Village Phase 3. This is the one at the corner of Zonal and Mission, and will include 300 units of permanent supportive housing. But Nancy here is here to talk about the workforce development program that her organization is offering to that site. So Nancy, take it away.
Thank you so much, Heather, and good morning to everyone. I'm so glad to be here. This is my first time participating in your meeting, and I am very excited to start building relationships and getting to know you in this wonderful community. that I am visiting today for the very first time. Our nonprofit, Los Angeles Habilitation House, we're currently located in Long Beach. And so we are currently in a Century community down there called Century Villages at Cabrillo. When we started the nonprofit, we're 18 this year, so we're very excited to be 18 and kind of growing up and finally having learned something. We understood the need for work, put very simply. There's a lot of supported services. You can have your resume written, you can have interviewing, mock interviewing, informational interviews, which are all very important and necessary. What we understood was the need for jobs that were, to lack of a better way to say it, that were maybe more human in the way that they looked at the staff that they employed. And these people had barriers to employment, some barrier, a disability, something. It didn't matter really what barrier they existed, but they needed a chance. They needed a supported human environment. They needed to not be afraid to be late to work, to need additional days off, to have a really bad day and still come into work and maybe just be left alone. They didn't need to be worried about these type of things impacting their security of their income and their job. And so that's the underlying feeling, so to speak, of why we started LAHH. We're very excited to be part of the Century Project up here in East LA. And one of the big questions that we have is what type of channels and pipelines, training opportunities, what do you need in this community to achieve economic stability and independence? What kind of jobs do you need to have a savings account for that rainy day that none of us know when will happen in our lives, but it will inevitably happen at one point in time. So I'm here to learn and get to know you and try to develop the workforce development program that's adjacent to here that you will find to be relevant. You will find it to be new. It hopefully won't be redundant, and it will hopefully produce jobs that you want to have, this community wants to have, and a career where you can move through life, gaining experience, gaining promotions, and gaining that stability. The end of the day, when we go home from work, it's not possible that every day feels like a home run. It's not possible we're world champs like our Dodgers were last year. It's not possible that that's every day, but it would be great if it was more times than not. And we think that's possible. And we're here to listen and learn and create a program, again, that is relevant to what is needed and that is not redundant. My name is Nancy. We're on social. Everyone tells me this, so I'm just going to preemptive. The third word of our title is weird. People tell me habilitation house. We're not rehabilitation. The simple reason is we're not a formal rehab program. So you're not entering because something has to change. I have friends that have gone through AA, which is a rehab program. They needed to change their relationship with drugs and alcohol. What we do is we just want to go together, which is your career, which ultimately needs to lead to economic income stability. So you can get in touch with us on social. I'll keep showing up to these meetings and keep being available. Thank you so much for your time.
Thank you, Nancy. So I know that it's very early days. We don't have a lot of specifics yet about the role that Nancy's organization will play at the Century Housing Project, but Nancy wanted to start participating in these meetings and get to introduce herself and her program to all of us so we can start that dialogue, start that conversation. One quick question I have for you are the services you're providing for the residents of the Restorative Care Village and Century Housing Project, Or are they for the people that might be providing the services at the restorative care village, or a combination of both?
So the workforce development piece that we are developing right now and planning, the idea would be that it is for anyone in the community who is wanting to get a job and needs some training, some upskilling, reskilling, a certificate, something to be able to start that career path. So it's open to the community.
Fantastic. I didn't realize that that's how broad it was. How exciting. A question.
That was actually my comment, as far as making sure that it would be used, not just for the residents, but for everybody outside. The other thing, and you might see, like, we're in I'm sorry. Okay. Am I being not loud? I thought I was being loud. Okay. It's okay. So, so you help them get jobs, or you develop jobs for them? Both? Okay. And then my other thing is, know that this is Boyle Heights, is not East LA. For people, just, it's like a little thing, and actually you're going to be on the border that's of Lincoln Heights and Boyle Heights.
Lincoln Heights and Boyle Heights. Thank you for the correction. This is new for me. So Lincoln Heights, where are we right now? We're in Boyle Heights. So we want to understand the needs of the community for jobs and help to train, upskill, reskill, and help people get into a career, because that's ultimately where the economic stability comes from. So, so in Lincoln Heights and Boyle Heights. Thank you. Here.
Are you taking questions from Zoom?
Great, thank you. And we do have a couple raised hands. I'll ask Alex if you want to ask your question first, or your comment.
Yeah, good morning, everyone. This is Alex Damas from Century. I'm sorry I can't join you in person today, but we just wanted to offer our support to Nancy. Like she said, we've had a partnership with them in Long Beach for many years, and it's been a very successful partnership, which is why we were very excited to bring them to this new project that we're working on the restorative care village. As she mentioned, it is intended to be an amenity for the entire community, and we are absolutely open to hearing what the community thinks would be best there. So thanks, everybody, and thank you, Nancy.
Thank you so much. And I think we may have one other raised hand from Elizabeth.
Yes, hi. I'm Liz Harrell. I'm come to these meetings a little bit over the years from the Eastern Los Angeles Regional Center. We are one of 21 regional centers, one of 7 in LA County that serves folks with intellectual and developmental disabilities. We serve the Eastern LA portion of LA County that includes Boyle Heights and City Terrace. We're so excited about this project. I think every time I come to these meetings, I say that. Just excited to hear about a Habilitation House, and would love to connect with you, Nancy, in regards to the individuals we serve. We do have an employment specialist. I'd love to get you connected with him. And we have a lot of ideas, I think, that we could bring to the table on this project. So I'm going to drop my email in the chat, but I know you said you're going to share how to get in touch with you as well.
Yep, sounds good, Elizabeth. We will definitely connect you and Nancy. And again, this is early days, but we're excited to build these partnerships as we move forward. So we are a little bit late on time today. So I've asked if we might, I've asked Alicia Ramos if we might have postponed her presentation on Restorative Care Village 4 and 5 to next meeting, so we could take advantage of the wonderful speakers we have from Century here in the room with us today. So I invite our fabulous colleagues from from Centennial, from Centennial, to please join us at the podium and help us with the presentation on the revitalization of the Historic General Hospital in West Campus.
Good morning, everybody. It's good to see you. My name is Leandro Tyberg with Prime Store Development, also part of Centennial Partners. And we're going to talk a little bit today about some of the opportunities and challenges that we have related to our project itself and affordable housing, which is a direct and important component of what we need to do. And do I just press right, or do you change the slides with the arrows? Ooh, look at it. As we've often talked about over the last year and a half, there is a dream that we have to revitalize this campus, to rehabilitate the historic General Hospital. And that's all going to be done in partnership and in concert with the community vision and our partners at the Wellness Center, SD1, DEO, CEO's office, and all of the county family. We are embarked upon a very long-term engagement process that we like to say is perpetual. Our commitment to community outreach is never going to stop. It is a lifestyle, not an obligation. And so we are continuing through that process now. The community over the last 7 to 10 years has identified significant pillars and critical components that we have basically reduced to 5 central concepts. And we are doing individualized presentations approximately every 60 days based on each of the topics. And we're also doing individualized meetings to expound deeper on each of these topics. We will also be hosting community at-large meetings throughout the year specifically on these topics over a multi-hour period where we can really dive deeper and get much more community input and dialogue. Today, it's just a little bit of an overview. So let's talk a little bit about some of the key priorities related to our perspective on affordable housing. And I would like to introduce my partner and our vice president at Prime Store in charge of all things residential, Mr. Blake Coddington.
Thank you. Thank you so much, Leandro. Very excited to be here with you all today. Thank you for the opportunity to talk to you about the crazy world that is affordable housing. There are many complexities and layers. Today we seek to give you, like Leandro said, a high-level overview of some of the tools that are commonly used to finance and develop affordable housing. We're also going to talk about some of the very real challenges that exist in today's market, things such as high interest rates, unstable political environments, and availability of local funding. And then we're going to finish the presentation with ways that we think the project can still be successful despite these challenges. So again, let's jump into it. Okay, what are some of the tools that we can use to finance affordable housing? So every affordable housing deal development usually has 3 buckets of money. It requires funding from the local government, funding from the state government, and then funding from the federal government. All 3 of those must be present for affordable housing to be developed. So the first couple slides are going to focus on the local government. LA County has a development agency called LA County Development Authority. They both control the commitment of capital dollars or construction money that allows housing to be built, and they control the award of what's called Section 8 housing vouchers or project-based vouchers, and that is a rental subsidy that enables developers, community developers of these types of projects to leverage larger loans that helps pay for the building. So these are some of the statistics on types of funding that are available from those from that local housing authority. Here also is a little bit on the voucher program. And in addition to leveraging larger loans, the income from the voucher and the additional revenue allows the building to offer supportive services that meet the needs of the residents. And so housing exists, affordable housing exists on a spectrum. We can serve low income, we can serve seniors, we can serve transitional age youth coming out of foster care, and all different variations of that within that spectrum. So the voucher program is a federal program, but it's administered by the local government, the local housing authority, and they're critical for the success of the project. Once we secure local funding is our first step. Then an affordable housing development must apply for state funding dollars. There is a state agency called the California Housing and Community Development Department, HCD for short. They have a variety of different programs from transitional housing to permanent housing and everything in between. I've highlighted a couple of the permanent housing programs here for you today, and we can do a deeper dive on a working session like Leandro mentioned. This is one program I'm particularly excited about called the Affordable Housing Sustainable Communities. This is very relevant to our conversation earlier with Jay about the Metrolink station. This redirects, this is a California climate initiative that redirects cap and trade dollars for greenhouse gas emissions to affordable housing that is located near transit. So by way of example, if one of the affordable housing or 2 of the affordable housing developments on the General Hospital campus were to receive these funds, these dollars would help to pay for affordable housing, but also create off-site connectivity from the housing site to the Metrolink station that is, contemplated just a few blocks away. So that could be new bike paths, expanded sidewalks, beautification through landscaping, and then also building out of even, transit stations. So this year alone, there was $775 million available that developers are applying for. And that fluctuates by year, but it gives you a sense of the scale of this source. Along the same lines, another state program that's commonly used is called the Infill Infrastructure Grant Program. Very similar. This pairs with affordable housing developments that have on and off-site infrastructure improvements, streets, sidewalks, landscaping, expansion of underground utilities. Those are all, great features. I pulled this one out of the batch of HCD programs for a reason. They also have a available program that would allow a group of projects to apply for IIG funds through a qualified infill area. So any new housing projects, dozens and dozens, hundreds and hundreds of units that reside around this area would all be able to have a direct access to these funding dollars through just a single application. So it's a major vehicle that allows housing to be enabled and come along very quickly. And now we move to the third prong of our funding. We have local, we have state, and now the federal, funding program. The low-income housing tax credits. This program was created in 1986, and this is meant to introduce private investment into affordable housing. So there are two different types of low-income housing tax credits. There's a 9% credit and a 4% credit. The functional difference, they're about, twice, 9% is twice as valuable as the 4%, but it allows developers to gather up their estimated costs for the project and receive an allocation of these federal tax credits for doing this work. And once the project has received a commitment of credits, the development team then goes to the private investment community, large institutions like Wells Fargo, Citibank, Union Bank, US Bank, and many other different size investors, and sell these credits to the project. And in exchange for selling these credits, those large institutions will give equity up front that pays for about 40% of your overall cost. So we're getting construction dollars in return that allows the project to go forward. So we're combining the local funds, we're combining the state funds, we're combining the federal tax credit, which ultimately is private investment. And that enables affordable housing to happen and happen quickly. Something I will mention as I flip through this, these are competitive application rounds. So there is so much need in our region and in our state that housing tax credits and also local dollars are received and awarded through a competitive process, an application process. And we can talk a little bit more about that as we proceed through the presentation. So now I'm going to turn to what some of the very real challenges are in our industry. Leandro and I are both going to talk about these areas, but as I mentioned, there's a significant amount of local funding that needs to be committed up front at the start of the project. And that is really the grease that starts turning the wheel that is the development process. And once local dollars are committed, it allows for better competition, and it allows for competing on the state level to gather more dollars. So this is a very critical step, and it really must be there for these to happen. The second is that, I could have blended those two, highly competitive application process and significant local funding. And then often, I'm sure you all have remembered in recent election years that there are new ballot initiatives and propositions that often come out to fund different types of affordable housing. And those ballot initiatives will be attached to dollars serving certain populations. So as a development team and a set of community stakeholders and partners, we need to approach the financing of these projects in a very open and creative way, because the financing changes regularly, and that type of financing might dictate the path that the project goes down. Okay, and I'm going to turn it over to Leandro to talk about some of these challenges.
Thank you very much, Blake. Look, we all know this is a very challenging situation, both on this type of project, but also as we're facing as an industry. This is one of the largest projects ever conceived when it comes to doing something this radical in trying to help the community and trying to create something that is absolutely beneficial for the wellness of this community. Because it's a non-traditional project, that creates non-traditional problems, but it also creates a lot of opportunities as well. We understand that the project will require some degree of phasing, because certainly there's no way to apply for all of this type of financing in one season. There simply isn't enough financing out there. So we are going to have to sequence this in a way where we ensure success. Ultimately, the historic structure of the General Hospital, which we absolutely love and respect, does create some degree of limitations as it relates to the structural grid. How best to optimally lay out units is a bit of a challenge, also presents an opportunity in itself. And as Blake was hinting at, without financing of the public dollars, it really limits our ability to produce the amount of affordable housing units that we want to create. We do see this as a paradigm changer for our industry, and we're up to that challenge. We also have the challenge of the need for upfront investment. Obviously, this is a major campus reposition, and a lot of dollars need to be put into the technical analysis, the work to what I like to say is set the table so that we can ultimately create investable opportunities. Working on the seismic rehabilitation of the hospital, the remediation of the environmental conditions and the toxins that currently are there is a priority that we need to deal with before we embark upon the process of applying for those tax credits. Another one of the challenges that we face is when you look at a property of this size, you cannot create affordable housing individually, floor by floor, mixing it with other uses. You have to create them in a vertical structure so that they have their own ownership entity for the tax credits and the nonprofit structure. So we do have to designate which components of the building will be allocated to the affordable housing and find a way to blend them in a community vision so that at no point does it feel like any part of the project is segregated from another. As we deal with the macro factors facing affordable housing, our community, and our industry, clearly it would be false not to discuss the uncertainty, the fear, and the challenges that we're facing related to the current political climate. Obviously, we have a certain perspective about needing to help those that need the most help. And we hope that as the political climate ameliorates and stabilizes over time, we hope that the Washington understands its need to support our local community, because frankly, we do need the support, especially from HUD and the federal government. Ultimately, there are other macro factors that affect our ability to proceed with the full financing of the affordable housing. The climate related to interest rates, the climate related to the uncertainty of the tariffs. Many challenges face us, and many opportunities come with that as well. As I mentioned, setting the table, some of the challenges that we're also facing, especially when it comes to working with our union partners, of which we are signatories and happily so, is getting to an understanding of the construction numbers and estimating itself. Right now, because of the uncertainty related to the supply chain, tariffs, and concerns about what that will do to affect subcontractor pricing, it is challenging to pin down the actual cost of the project. that is a challenge, but also an opportunity as well. At the end of the day, what we need to do is create order from chaos and create a position of stability when it is a time of instability and uncertainty. And now we're going to talk a little bit about some of the opportunities related to that.
Thank you so much. Yeah, so we did touch on quite a good deal on the challenges, but the opportunities are vast. And so as a important partner and stakeholder in this, we have started to think about what a master plan approach, what a master leasing approach might look like. So as the site control of the campus, as well as the land use approvals become, clearly defined, there's an opportunity to engage more of the private development community, where we as a stakeholder group identify development ready sites and lease those out to others within the industry that can build and create units in parallel to what Centennial Partners and you all are embarking on. So there's a really great opportunity through master leasing to expand the number of units that we can develop together. Another opportunity that we have ahead of us is using various creative solutions to deliver units. So one that many of you may be familiar with are innovative building types. So potentially building and constructing units in factories off-site that allow for, more certainty around the construction costs. Factory-built housing as well would not be affected by weather delays, and we'd be able to start the construction of those units while the construction on site is happening. So in essence, that is overlapping parts of the construction and potentially shortening the duration of the projects, hence bringing units on much faster. There's also a fairly vast movement within the multifamily housing community to develop income restricted housing without these competitive low-income housing tax credits. So this concept is similar to a market rate development where it has traditional financing and outside equity, but the development team would agree to restrict the units on the upper end of what would be considered low income. So many of you might have heard the word thrown around as workforce housing or attainable housing. That is usually referring to an income range of 80% AMI up to 120% AMI. And setting aside the units to that level could allow a project of the right scale to access private investment and not use tax credits. So this is a very commonly done option within our region. And finally, before I hand it over to Leandro, there is within the Section 8 voucher program, I mentioned earlier the need for project-based vouchers where a developer, a specific building would have access to this revenue source. There's another part of this Section 8 program called housing choice vouchers. And approximately 100,000 people within Los Angeles have a housing choice voucher that they use to cover their rent. And so that voucher would allow a resident to continue paying 30% of their gross income, but the remainder of their rental payment would be paid by the government through this housing choice voucher. Why is that important? That's important because the lending community today looks at housing choice vouchers as an uncertain thing. While there is many folks carrying those vouchers, they have a very difficult time underwriting because there's not certainty that the residents carrying that voucher will end up living in these buildings. So there's an opportunity for public agencies to be financial guarantors that would give the lending community comfort and allow this revenue source to be leveraged more broadly. So a couple ideas here, and I'm going to hand it over to Leandro.
Thank you very much, Blake. Let's talk also about what's the number one tool that we have to create project success. You, every single one of the members of this community want this to happen. We believe that we can create an unstoppable momentum to achieve the success that we are looking for. This is an amazing opportunity, and this community has worked for so long to push forward on concepts related to affordable housing. I also want to say that it's our job to unlock every possible tool out there. We are absolutely committed to making sure that affordable housing is a key component of the project. And it's also important to understand that we have committed to begin with a minimum of 600 fully restricted units and making sure that at least minimum 25% of the overall project is for covenanted restricted housing. We are going to be focusing on low and very low levels of AMI. So below 50% for low and 30 to 50% for very low with wraparound services. The workforce housing that Blake mentioned, we do believe is a key component, especially for potential nurses, teachers, doctors, or other workers that want to live on campus and work here. But it is a full spectrum approach. And we would also love to be able to consider multi-generational housing so that we also have our senior population, our family population, transition age youth, and really try to look at the family member from a holistic whole spectrum of servicing their needs. It's hard, yeah, but nothing is easy in life. And this is an amazing opportunity for us to achieve everything we've always set out to do. One final item to note. Usually, time kills projects. As it relates to affordable housing, though, we actually can turn this into an amazing opportunity because when you're applying for affordable housing credits, you can't begin your application until you're fully entitled. And we have not even begun that component of the process. So we actually have some time. We actually aren't going to begin the application process probably for about 18 months. So we have a lot of time to work with you on figuring out what's the appropriate toggle of senior, low income, very low income, permanent supportive. What's the appropriate mix? What does the community further want to see related to each component of that? And how do we blend that in a philosophy together so that when we begin the application process around 18 months from now, we really can go with a surgical approach. And God willing, things have stabilized a little bit related to the political uncertainties and the industry itself, so that when we launch into that track, things are a little bit better from a certainty perspective than they are now. We know there are 1,000 questions and we are willing to take them, of course. But as noted earlier, we do intend to actually create a workshop on this for a couple hours at large with the community where we can really sit down and go over them in much, much more detail.
Thank you so much. Before we turn to questions in the room, we do have a question about Measure A and Measure ULA funds and how those might be utilized if appropriate.
Those are both funding, Measure A and Measure ULA are both funding sources that may be available once it's time to apply for funds here. The latest that we've heard on Measure A is that the county might not have Measure A funds available until the early part of 2026. With Measure ULA, I know that's been a contentious, to say the least, contentious measure within the city. Last that we heard, the city had not realized some of its economic projections of how much funding from Measure ULA would be available for affordable housing projects. But there is certainly ears to the ground in terms of the availability of those funds and if they can be used for this housing once we approach that point. ULA is the city, and that is, some folks may know it more commonly as the mansion tax, or if there's an exchange of property exceeding $5 million, there is a fee assessed to that sale, and that generates affordable housing or general funds for the city to be able to invest in affordable housing.
Do we have any questions in the room for our partners from Centennial? Okay, you guys have done an amazing job. We do have a comment in the chat, which will, I think, surprise no one, that greater advocacy for more units. 25% is just the baseline we hope, and we want to go higher than that, if at all possible, of course. With that, I think we are concluding our meeting. Thank you so much, one and all, for staying with us through a little bit of extra time today. Obviously, we had a very rich, full agenda, but luckily, every single partner who came and presented here today will be coming back. So this is the jumping off point to conversation. Please stay tuned for an email with the presentations and materials and contact points for all the people included today. As a reminder, we will have our upcoming schedule of meetings, both in person and available via Zoom. We hope you can join us there. And again, as we wrap up our meetings, I did see a comment in the chat from Father Chris Ponnet. Again, remembering the life and legacy of Father Richard Estrada, who recently left us, but his legacy and the incredible gifts and commitment he had to this community will continue on. So thank you one and all for joining us, and we will see you hopefully back here on May 2nd.